Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today I want to come on and do a discussion about hip pain related to back pain and VA disability. So let's start off talking about how hips can be service connected. So today we're specifically going to get into those secondary service connections to back pain, but just for an overview, a person can be service connected on a direct or primary basis if they injured their hip on active duty and it's continued, right? If it existed prior to service and it was worsened beyond its baseline or aggravated beyond its natural progression due to some service connected or some occurrence that happened in service. And then on a secondary basis, it can be related to other disorders. So maybe it's your knee, maybe it's your back, maybe it is even weight gain, right? So somebody had a whole bunch of weight gain, and we've done videos on weight gain as an intermediate step. Maybe you had weight gain related to, some disorder that you had to take a bunch of steroids for, and you gained 150 pounds, and that put a lot of weight on your hips, right? So one of the most common causes of hip osteoarthritis is actually weight gain. So those are some of the secondary ways that a person can be rated for hip conditions. So when it comes to the low back, let's talk about how that can relate. So what kind of hip conditions can a person be rated for? So just hip pain or hip strains or hip sprains, osteoarthritis. You could have rheumatoid arthritis of the hips. You could have femoral acetabular impingement syndrome, which is also referred to as FAI. That's something we've done videos on in the past. A person could have osteoporosis. They could have a slew of different conditions. You could have bursitis. You could have something called IT band syndrome. You could have multiple things going on at the same time, a labral tear in your actual hip joint. So how does the back relate? So I'm going to pull up some of my articles that I use so that you guys can sort of look over them and maybe take them to your doctor and see if it applies to you, and see if they're going to write an opinion for you. They might agree, hey, your back is probably causing this, or your knee is probably causing this. But today, like I said, we're going to do that back. So the first article that I like to use is Disc Degeneration in Lumbar Spine Precedes Osteoarthritic Changes in the Hip, which was published in the American Journal of Orthopedics in 2013. It discusses the relationship between the hips and the spine. Says that they performed a study of 340 cadaver human specimens and analyzed the relationship between the hip pathology and lumbar conditions. They found a significant association between lumbar conditions and hip changes, which suggests lumbar degeneration processes precedes that of hip injuries. Another study titled Effects of Low Back Pain on the Kinematics and Joint Coordination of the Lumbar Spine and Hip During Sit to Stand and Stand to Sit, published in Spine in 2005, evaluated the lumbar spine and hip joint movements during activities in patients with low back pain. And there's some good information in that article. Another study titled Adaptations in the Pelvis, Hip, and Knee Kinematics During Gait and Muscle Extensibility in Low Back Patients, a cross-sectional study published in the Journal of Back and Musculoskeletal Rehabilitation. And another study, The Effects of Hip Exercises for Chronic Low Back Pain Patients with Lumbar Instability, published in 2015 in the Journal of Physical Therapy Science, describes various ways that lumbar back pain contributes to the development of hip pain. So those are some good articles that you guys can pull up and take a look at. Let's talk about ratings really quick. So I am not a legal professional. I'm not an attorney. I'm not a VSO. Or an accredited claims agent. If you need one of those people to assist you with strategy or filing your claim, you can go ahead over to va.gov and you can check out there's a search tool that you can use to find somebody. I'm a medical professional and I help with these types of opinions at times. They're not always required or needed, and you can also get one from your primary care provider or your treating doc or whoever, or the VA. So some of those ratings though, and these are always subject to change, right? So you can be rated for osteoarthritis at 20 or 10%. You can be rated for ankylosis. So that's like some stiffening and immobility in the joint. And those can be at 90%, 70%, 60%. You can be rated for limitation of motion, hip replacements, If it is causing you to be unemployable, that can be considered for that as well. So I hope this was helpful, you guys, when it comes to how the hip can relate to the back. And if you guys have any questions, please drop some comments. And as always, thank you for watching. Please like and subscribe. See you guys later.